And we're back with On the Record with Tiffany and my guest, Dr. Richard Gibney. And I want to share this with you, Dr. Gibney. I was thinking about you this weekend because when on Friday, as the weekend began, I was talking with ASN and some of the other kidney organizations, as my day job is with the Texas Kidney Foundation. So afterwards, I was, just doing my usual stuff of talking with family, and my mom contacted me because my cousin had gone to the hospital, and apparently we have kidney issues throughout the family. So there's so far we've lost 4 people to COVID-19, and we're Abe went to the hospital and had a procedure done because his kidneys, I guess they weren't functioning quite right, and so what my cousin described, she said they flushed out his kidneys. I don't know what that means. And when she says that, I don't know what exactly the procedure is, but he came home and he was standing there talking to his sister, and he just fell down in pain and said that he was in pain and never got up again. And I thought, man, my mom called me and we started dealing with what this is, and dealing with death again, yet again, to kidney related issues. So when I'm listening to you as a physician talking about, and you're always the one that I think of because of your heart for people. So when I'm listening to you as a physician talking about patients and talking about people, talking about us, those of us who don't have the best hand dealt to us when it comes down to our organs and kidney function, I really, I feel like there's hope, and that's what I share with my family when we're going through these untimely deaths and difficult hospitalizations, and especially since COVID-19, because when you have to say goodbye to somebody and they're about to be intubated, that's a horrible goodbye, because they know that they're going and that they're going to go alone. So, I'm very thankful to you for everything that you're doing to bring all of the knowledge and the best of our programs together to get us what we need, which is some hope and some power, because it feels terrible when you're hopeless. Hopelessness is the worst thing we can offer to people. So you're doing something really good. That's why I keep bringing you back, because I'm like, it's like when you go to church, the preacher keeps preaching the same sermon and people are like, why do you keep telling us the same thing? And you're like, and the preacher says, I keep telling you the same thing, and I'm going to tell you the same thing until everybody gets it. And start doing it. And that's kind of your job. You're telling us all the same thing.
Well, again, the future is bright and hopeful.
It is.
So, for example, if you said technically, how can you help me technically? Well, first, again, it's that awakening, and I've got to figure out how can I make sure that we as a medical team are communicating to the person. So that person knows that, let's say they have diabetes and some mild decrease of function, and they should be on there are these medications called ACEs and ARBs, and they're blood pressure, and they're good for your heart and protective for your kidneys. Well, when we do our surveys, even though this is best practice, evidence-based medicine, 50% of people are not on them. And there's, again, a variety of reasons why, financial, social problems, injustice, social injustice, etc. Reasons why they're all fixable. We can fix them. We can make them better. So the question is, how do we get you on the drugs all of us already know you should be on, but somehow you didn't get on them because the system just didn't work right. We can fix that. The next thing is there's a relatively new drug that's very expensive. Costs, I've mentioned it before, SGLT2 inhibitors. And these are great drugs. They're a diabetic pill, but they also are powerful to stabilize heart and kidney function. Well, January 1st, we get to, instead of paying $600 a month for for this medicine, you'll pay $4 a month, because we can get drugs from Canada, Europe, Australia, so the cost of drugs will dramatically fall. So we can get you new drugs as they're coming out that are inexpensive and available to everybody, so that the most delicate in our whole family are not harmed by what's going on. And then finally, there's the perfect example that Tiffany's given is the whole experience with the COVID pandemic, is that we will do better, but the focus has all been about, and if you listen to Tiffany's story, a component of her story was medical, about the medical problems. The other component of her story, though, was the spiritual, emotional, and mental problems caused by the pandemic. So we have to do better with that. So for social determinants of health, meaning food, clothing, shelter, simplistically, mental health, for the social injustice that's with us, that who of the whole group have been harmed the most in the pandemic? The marginalized, the poor people, the most vulnerable. So we need to help all those people. If we'll do that, and we'll add that to our passion for technically excellent medicine, you can see the greatest doctor in the world, but if you don't have any money, and that's another component of this, is telehealth. God bless telehealth. Normally, and we're the best example. Tiffany and I would have a meeting in person, and I sit there and blah, blah, talk to her, and she talked to me. And instead, we can do teleconferencing. We can do telehealth. So instead of you having to get a car and get your kids in the car and get in the thing and drive there in the waiting room, you can, guess what? I'll come to your house. I also get a better feeling for who you are. If you have children, if you have dogs and cats, if you're poor, if you're rich, whatever, because again, it's that, again, you've heard a lot of stories from Tiffany and myself. Stories, relationships, and trust. If you know that your medical team loves you, and that's why we had such great success, and it's an unconditional love. You can have a lot of trouble and difficulty. We'll still love you. We don't care. Our job is to care for you. And if we love and care for you, that's a huge deal, because we're going to find some way to get you the resources you need so you can be successful. And doing that.
Dr. Gibney is saying that one of the reasons why I really enjoy Dr. Gibney so much is because that is exactly what he delivered over his 40 years in medicine, and it's exactly what I see at many of the practices that I have the pleasure of getting to visit. In many of the dialysis units that I've had the pleasure of getting to know people who are on staff. There, some of your social workers, there's just nobody better than and no better resource than the social workers. I mean, they have a heart for the people that they're serving. The same thing with the nurses. You cannot find a better patient advocate or a person who is going to advocate for them more than the nurses that are dialyzing them, because often you see the staff at the dialysis unit more than you see your own family, and so they become like family to you. I mean, my cousin Daryl, who is on dialysis and has been since he was 21. He's 32 now. He is so devoted to the people that are in his dialysis clinic in Houston. They are just phenomenal. They're top drawer. They check up on him like they all of the wins in his life, they're a part of it. Like when he does well at work, he's sharing it with them, when he's doing well, and when we're doing something for him as a family, he shares that with them. I mean, it's that is such a part of the nephrology community. I would say that component is already there. All we have to do is tap into that, at this point.
Exactly. We're taking all that's good and keeping all that's good.
That's right.
Don't be shocked. Within 3 to 5 years, we have implantable artificial kidneys. So therefore, again, another reason why you won't be on dialysis. In 3 to 5 years, 80% will be on home therapy because, again, it'll be so convenient. If I tell you, you got to drag this giant machine with all this disposable products and just fill up your house with stuff, you go, I don't know about that. We give you something that's simple and easy to use. It's like going from a giant old console TV to a little laptop. You'll say, well, I can do a laptop. Well, you can do the same thing with the small portable dialysis machine. And those things are coming out. This year, we've already had one come out. There are 2 more coming out this year. There'll be more next year. So basically, we're going to make it easy, convenient, and cheaper, so that we can take that money we save and use it for all the other problems that are going on. And then for all the staff, they have job security. So if we do it with dialysis, it's okay. We'll go on to something even better, so that we'll say, gosh, remember the days when we used to do this thing called kidney machine treatment, washing machine treatments? We don't do it anymore. But we have these other extraordinary things we're doing with monoclonal antibodies and cellular physiology that changes the world. And that's where we're headed. So everybody should, if they do have to go on dialysis, they should take the attitude that they're going to figure out a way to get me off dialysis, to get me a better quality of life, to give me better health. And we're not going to be satisfied until we can get to that point where we have everybody healthy and well.
And you've been listening to On the Record with Tiffany.